Baylor's Faith in Action Initiatives cooperates with all kinds of other groups, other hospitals in Dallas, as well as Water is Basic. That's a mission organization that we're working with for this particular load that's going to South Sudan. And we also depend on lots of volunteers. If it were not for good-hearted volunteers that constantly on a weekly basis assist us, we would have great struggle in making this an enterprise that makes a difference around the world.
We have here are about 6 pallets that are about 6 feet tall of medical supplies. The supplies is for a hospital and clinic in South Sudan. And so what we've done is we have compiled a number of different medical supply items, from surgical packs to gauze to gloves and syringes and needles and different types of items that have been requested by the Sudanese people for their clinic and their hospital. South Sudan is a very poor country, and so they have a need for pretty much any type of medical supplies, and what we have focused on here is the most basic type of supplies. And hopefully that will help to meet a lot of needs in the near future.
There's a higher rate that a lady will die in childbirth than she will finish primary school. That's the situation that we have in South Sudan. So anything that we can do on extra supplies that we have that are not needed in the Baylor healthcare system anymore make a tremendous difference. And we find that this particular load to South Sudan going out today meets a tremendously big need for a brand new country.
We send our team who goes and picks up these supplies 2 to 3 times a month from these different hospitals and brings them to the warehouse, where we sort and organize them to send them out around the world to areas in need.
Today, Water is Basic and Baylor are partnering together to fill a container that will provide beds, medical supplies, surgical equipment, you name it, for people in South Sudan who had built a room not knowing that they would get any supplies in the next 2, 3, or 4, or 5 years. Hopefully in a month they'll have these supplies and they'll be able to help people who are suffering and dying of basic diseases that are easily preventable.
Because in Sudan the electricity is a factor where they don't have electricity in a lot of their cities, we are sending them manual stretchers, as well as we're sending 5 hospital beds which can be used in their hospital to outfit their ICU and surgery centers. So that's kind of our focus right now, and so hopefully we'll have some word from the people that it will arrive there in about a month. We know how great a need Sudan has for medical supplies. In fact, the places we're sending these to have hardly any type of hospital bed, medical equipment at all. So for them to be able to receive these, to be able to open this container and be able to have these supplies are going to make a big difference in the lives of these folks.